What inspired you to pursue a career in nursing, and what motivates you to continue in this field?
I have always been drawn to helping others, and nursing allows me to do that in a meaningful way. I find the work incredibly rewarding, and the opportunity to make a positive impact on someone's life is a constant motivator for me.
Can you describe a challenging patient care situation you faced and how you handled it?
One time, I had a patient who was very anxious and resistant to receiving care. I took the time to listen to their concerns and worked with them to come up with a plan that made them feel more comfortable. Through patience and empathy, I was able to establish a positive relationship with the patient and provide the care they needed.
How do you maintain patient confidentiality and privacy in your work as a nurse?
Maintaining patient confidentiality is of utmost importance in nursing. I ensure that I only access patient information when necessary, and I take great care to protect patient privacy by following proper protocols and HIPAA guidelines.
Can you discuss your experience working with patients who have complex medical conditions or chronic illnesses?
I have had the opportunity to work with many patients who have complex medical conditions or chronic illnesses. I find that taking the time to understand their unique needs and challenges is key to providing effective care. By working closely with the patient and their healthcare team, I am able to provide comprehensive and compassionate care.
How do you prioritize and manage your nursing tasks and responsibilities during a busy shift?
During a busy shift, it's important to prioritize tasks based on the urgency of the situation and the patient's needs. I make sure to communicate with my team to ensure that tasks are appropriately delegated, and I try to maintain a calm and organized approach to manage my responsibilities effectively.
Can you explain your experience with interdisciplinary collaboration and communication with other healthcare professionals?
Interdisciplinary collaboration is essential in nursing. I have worked closely with other healthcare professionals, including doctors, social workers, and physical therapists, to ensure that patients receive comprehensive and coordinated care. Effective communication and teamwork are key to achieving the best possible outcomes for our patients.
How do you approach patient education and ensuring that patients and their families understand their care plan?
I approach patient education by tailoring my communication style and language to fit the patient's needs and level of understanding. I also use visual aids and teach-back methods to ensure that patients and their families have a clear understanding of their care plan.
Can you discuss your experience with implementing evidence-based practice in your nursing care?
I regularly review and incorporate evidence-based research into my nursing practice, ensuring that my care is based on the most current and effective practices. I also participate in continuing education and attend conferences to stay up to date on new research and developments in the field.
How do you approach end-of-life care and supporting patients and their families during this difficult time?
I approach end-of-life care with compassion and empathy, and I prioritize open communication and collaboration with patients and their families. I also provide emotional support and connect them with appropriate resources, such as chaplains or grief counselors.
Can you explain your experience with administering medications and managing patient reactions or adverse events?
I have experience administering a variety of medications and closely monitoring patients for any potential adverse reactions. In the event of an adverse reaction, I quickly assess and respond appropriately, including administering any necessary interventions and alerting the physician or healthcare team.
How do you ensure infection control and prevention measures are implemented in your nursing practice?
I follow strict infection control protocols, such as hand hygiene and personal protective equipment, and regularly monitor and assess patients for any signs of infection. I also educate patients and their families on infection prevention measures and involve them in their care to promote a collaborative approach to infection control.
Can you discuss your experience with performing nursing assessments and developing nursing care plans?
I have experience performing comprehensive nursing assessments, taking into account the patient's medical history, physical exam, and any other relevant factors. Based on this assessment, I develop a nursing care plan that addresses the patient's unique needs and goals, while also collaborating with the healthcare team to ensure a holistic approach to care.
How do you approach patient safety and error prevention in your nursing practice?
I prioritize patient safety through proper communication, adherence to protocols and guidelines, and ongoing education and training to identify and prevent errors.
Can you explain your experience with wound care management and the use of specialized dressings and therapies?
I have experience in assessing and managing various types of wounds, including pressure ulcers, surgical wounds, and diabetic wounds, using appropriate dressings, therapies, and interventions to promote healing.
How do you approach nursing care for patients with mental health conditions or behavioral challenges?
I collaborate with a multidisciplinary team to develop a holistic care plan that addresses the patient's physical, emotional, and social needs. I also prioritize communication and building a therapeutic relationship to promote trust and encourage positive outcomes.
Can you discuss your experience with implementing nursing interventions for pain management?
I have experience in assessing and managing acute and chronic pain using a variety of pharmacological and non-pharmacological interventions, including patient education, relaxation techniques, and medication administration.
How do you approach nursing care for pediatric or geriatric patients with specialized needs?
I use a patient-centered approach that considers the unique needs of each patient and their developmental stage. I also prioritize communication with the patient, their family, and other healthcare providers to ensure comprehensive care and positive outcomes.
Can you explain your experience with managing patient care during a crisis or disaster situation?
I have experience in responding to crisis situations and implementing emergency protocols to ensure patient safety and appropriate care. I also prioritize communication and collaboration with other healthcare providers and first responders to facilitate a coordinated response.
How do you approach ethical dilemmas and decision-making in your nursing practice?
I use ethical principles, standards of practice, and institutional policies to guide my decision-making. I also prioritize communication and collaboration with the patient, their family, and other healthcare providers to ensure ethical and patient-centered care.
Can you discuss your experience with using electronic health records, EHRs, and other healthcare technology?
I am proficient in using EHRs to document patient care, access medical records, and communicate with other healthcare providers. I also have experience with various healthcare technologies, including telehealth and remote monitoring tools.
How do you approach patient advocacy and empowering patients to make informed decisions about their care?
I believe in providing patients with accurate and accessible information about their condition and treatment options, and empowering them to make informed decisions about their care. This involves active listening, clear communication, and respecting their autonomy and choices.
Can you explain your experience with managing patient care in acute or critical care settings?
I have experience managing patient care in high-pressure, fast-paced environments such as emergency departments and intensive care units. This requires strong critical thinking skills, attention to detail, and the ability to work well under pressure.
How do you approach nursing care for patients with complex social or cultural backgrounds?
I believe in taking a patient-centered approach to care, which involves understanding and respecting their unique cultural and social background. This includes being sensitive to their beliefs, values, and preferences, and providing culturally competent care that meets their individual needs.
Can you discuss your experience with implementing infection control measures during a pandemic or other infectious disease outbreak?
I have experience implementing infection control measures during the COVID-19 pandemic, including following CDC guidelines, using appropriate personal protective equipment, PPE, and taking steps to prevent the spread of the virus. This includes educating patients and families on the importance of hand hygiene, social distancing, and other measures to reduce the risk of infection.
How do you approach ongoing learning and professional development in your nursing practice?
I believe in the importance of continuous learning and professional development to stay up to date with the latest advancements and best practices in nursing. This includes attending conferences, participating in continuing education programs, and seeking out mentorship and feedback from experienced nurses.